Hi guys, I'm Debbie with Via Medical Massage, and I have my friend Eric here. And Eric, tell us what you just had done.
I had a total right knee replacement.
Okay, how are you feeling today?
I've had better.
Okay, how many days ago did you get this done?
Monday morning, probably right about this time. Monday at 11 was when I went in for surgery. So that's 6 days?
Okay, so it's 6 days now.
Yep.
Okay, so as we can see, we have a nice fresh surgical knee, nice and swollen. You've got some staples on there. So do you have any trepidation about getting a massage right now, or any questions?
I don't. I'm kind of a newbie to all of this, so I'm really excited to see what happens.
Okay, perfect. So for those people who have had a more traditional massage, usually you're probably thinking I'm laying face down on my stomach, or even if you're laying like this, you're imagining me, using my thumbs or my forearms or elbows to rub muscles and things like that. So the technique that I'm going to do on you today is actually called manual lymphatic drainage. It has a very different purpose. It is not to manipulate any muscle tissue, but rather to address the swelling that's happening in your knee right now.
Yep.
So it's still going to be my hands on your skin, but it's going to feel more like a skin stretch technique, super duper gentle. You shouldn't feel any pain or discomfort in any way. So when someone comes in right after a surgery, we just want to cover a few bases. So I, as a therapist, always want to know what your post-op protocols are. So we know that it's okay that you can take off your TED hose for a couple hours, and we know that your surgeon wants to keep this knee straight. So I'm not going to bolster you with any pillows right now while I'm working on you. And when anybody comes in to see us after a surgery, this is always the first thing we check. Who's your PT? Who is your surgeon? Do you know what your lifting restrictions are, what your weight bearing restrictions are? And then how can we make you comfortable on the table so that we can proceed with the treatment and honor all your surgeons and all your PT's instructions.
Yep.
So we got our bases covered there. Now, as far as me working on this brand new incision with staples and everything, I am not going to be directly manipulating this incision whatsoever. Basically, what I'm going to be doing is I'm going to be working on areas just adjacent to that, but you'll never feel like I'm pulling or tugging or anything like that. I still have to respect the fact that this is new and it's sealed up. Once those staples come out, we can continue to work with you and start doing some scar massage on that incision. But we want to make sure that it's very well healed, everything's closed up, there's no signs of infection, things like that. But there's still a lot we can do today working around the incision to just give you some relief. A couple other questions I always ask people is, so we know we're going to work on the swelling in this leg. Are you having any body aches or discomfort anywhere else because you're walking differently or sleeping different?
Not really. I'm not normally a back sleeper, so it's actually been kind of better because I'm a side sleeper and I sleep kind of, I don't roll around much at all.
Okay.
So a lot of times, especially now getting older, when I wake up in the morning, like my arm hurts or my side hurts because I slept on that side all night long.
Yeah.
So now it's trying to get used to back sleeping.
Okay.
When you've never really back slept before.
Okay.
So like back and arms and everything feel okay.
Okay.
So
okay,
I really
awesome.
haven't done much. I've done a couple PTs, but I really haven't done a whole lot to, am I overworking this leg because this is my good leg, so this is still fine and everything else. So
Okay, perfect. Any headaches, anything like that?
No.
Okay, awesome. Okay, so I'm going to tell you a little bit about what we're going to do, how we're going to start, and kind of my rationale behind each of these. So I'm actually going to start off by placing my hands up above your collarbone, because all of the swelling and fluid that's happening in your leg right now, total normal response. The body has this swelling and inflammation and trauma response because it's trying to send nutrients and oxygen and all these good things. There's also a lot of waste products and just extra fluid. So all this fluid actually has to work its way against gravity, go through what's called your inguinal lymph nodes, through some lymphatic structures in your trunk, and then it actually terminates up at the top of your neck.
Really?
And then from there, it's going to go back into your bloodstream, go through your circulatory system, filter through your kidneys. So when you're done with this session today, you might feel like you have to pee a little bit.
Okay.
And that's how we know that our job is working, that fluid has gone through the lymphatic system the way we want it to. But other than that, like I said, everything's going to feel super comfy.
Okay.
So I'm going to just come behind you here, and I'm just going to reach above your collarbone. I'm just kind of feel up here. And I'm just going to do some little strokes like so. So might not feel like I'm doing much here, but I'm just working on these lymphatic structures just above the neck. And what's interesting too is any surgery that you've had, whether it's like, say a breast surgery, a leg surgery, a foot surgery, arm surgery, you always start at the top of the neck here. And that is just because this is where the lymph ultimately has to go. So I kind of describe it to people like a traffic jam. Like you'd have to move, the vehicles that are in one part first before you start moving other things that way. So we're just going to start with this. And this pressure right here, what you're feeling, is going to be the pressure that I use for the whole session. So you can feel that it's not, super deep or uncomfortable in any way. Do you have any questions so far as I'm doing this?
I don't think so.
Okay, cool.
It's interesting, like it has to come all the way back up to the neck though.
Yeah, so the lymphatic structure is in your abdomen. You actually have this big structure called your thoracic duct, and it does have valves similar to like your veins to prevent backflow. But yeah, it still has to work against gravity. The reason why your lymph has to flow all the way up to here is because this is just like a low pressure part of your lymphatic system. If you can imagine, like you have to have higher pressure down at the bottom to like move the fluid in the first place. So yeah, it's just how we were made. It's kind of an interesting thing, but
yeah. That's interesting.
Doing okay so far with just your knee being comfy and stuff?
Well, no.
Yeah. Don't worry, this first couple of weeks is rough, and then everything will start to kind of come around from there. Okay, next I'm going to do a little bit of work in your abdomen. Do you have any history of abdominal surgeries, abdominal trauma?
I had a gastric sleeve surgery.
Okay.
Well.
Okay, that would be fine.
3 years ago. 3 or 4 years ago.
Anything presently going on? Any abdominal trauma presently?
No,
okay. So I'm going to cue you to do some breathing exercises.
Okay.
And the reason why I'm doing this is because this is going to help to squeeze that structure inside your abdomen. That's going to help the lymph start to flow upward. Okay. So what I'm going to do is I'm going to place my hands on your belly, and what I want you to do is I want you to breathe in through your nose and then blow out through your mouth, and try to raise my hands with your breath, with your belly. So. Okay, that was sort of okay. So breathe down to my hand, fill your belly out, and then.
Okay.
You've probably never been in labor, so.
No.
Okay, another deep breath in, and I'm just going to press a little bit as you're breathing. Okay, deep breath in, and another in. And in. Good. Deep breath in. We're going to do 2 more, okay? And out. And in. And out. Okay, perfect. I feel okay?
Yeah.
Okay. I'm just going to do just a little bit of scooping, and this again is just to stimulate that thoracic duct in your abdomen. Have you ever had, like when you've had traditional massage, have you ever had like an abdominal massage? It's pretty great.
Yeah.
Yeah. One of our therapists, well, there's a few of our therapists that do it, but there's a gal that's, she's going to go to Utah this year and do like a full like visceral manipulation.
Huh.
So it's for like if you're having like tension in your organs and stuff, which you can imagine like people that have like IBS or different things like that. So I'm super excited.
No, it's crazy. Like people like in your guys' field and stuff like that. Like how in tune like small things that you can do to the body. Like it's crazy.
It's pretty amazing. Okay. Now I'm going to transition to start working on this leg. And again, kind of like that traffic jam analogy, I'm going to just put a little pressure here to clear your inguinal nodes. Then I'm going to start working on the thigh, then the knee, and then down to here. Okay. And so as I even start to work here, this is when you might start to feel even kind of like a drawing of fluid. It's because your lymphatic system has what's called a siphon effect. So once I start to empty and decongest structures up here, you'll start to feel this little bit of a pull. And it feels really soothing, basically.
Yeah.
So for right here, my hand's just going to go right here, and I'm just going to do a couple pumps like so. This is about as fresh as we get with people. And the technique itself, we have to move very slowly because your lymph moves very slowly. It doesn't move as quickly as blood does.
Yeah.
And so, if we were to do like really vigorous strokes, it wouldn't be very productive from a lymphatic standpoint. But
Got it.
And then where this ties in with PT is, so like you said, Adrian's not being very nice to you. Shout out to our friends at LOPT, Adrian and Victor and Nicole. You guys are doing awesome. But no, their job is to get this knee bending eventually.
Yep.
And it's tricky when you have this much fluid around the joint.
For sure.
So
That's what Adrian was saying, because I was asking like the pain and the movement and stuff, and he said the reason why like a lot of not being able to move my leg very well is because of the swelling.
yeah. The TED hose help a little bit with that. Like they're adding a little bit of a compressive force. And then once those staples come out and stuff, you'll be able to start doing some, they'll be able to start manipulating a little bit more too, like just the fluid, the tissue. And do you have any sensation around the incision at all? Like a lot of people report that they...
Not that I can tell. It's kind of weird, like the last couple days, and I don't know why, or not, probably, especially last night and the day before, like my leg is really cold and tingly.
Interesting, okay.
So I don't know, is that maybe because it's starting to get blood flow back in there or something? I don't know.
Could be. I would expect it to feel warm,
It hasn't been very warm. Like, Makara was helping me put my TED hose on the other day, and she came home from shopping, and she said, "Oh my God, your feet are like icicles." Yeah.
Okay. Yeah. Well, I mean, the TED hose too, like they do that because you're not as mobile, you're more stagnant, they're trying to prevent blood clots
clotting,
and
yep.
so.
It was still really weird though when I came out. They did the spinal block for this thing, and not having any feeling down there for like 6 hours. That was really freaky.
I went through that with childbirth, and yeah,
Yeah.
you're like my legs are like stumps, why can't I move my legs?
Yeah, I was like trying to wiggle my toes. I couldn't even wiggle my toes.
Everything feel comfortable so far?
Yeah.
Okay.
Yep.
Are you getting like nice zoomed in and panned out shots? Thank you, videographer. I'm not trying to tell you how to do your job.
All zoomed in for this one.
So Adrian and the gang will probably do some of this too, but yeah, when these staples come out and you're all healed, you can start doing scar massage on yourself. I always tell people, like, don't be afraid to touch.
Scar massage, really? Like massage the scar?
Yeah, so if this is like your incision, it's just basically you taking fingertips and just doing little circles. And as the weeks go on, it'll feel good to go deeper.
Okay.
You can kind of do like cross. It's called like cross fiber, but you can kind of go across like that. But the biggest piece of advice I give people is just like, some people are like, I don't want to see it, I don't want to touch it. And it's like, no, it's gonna heal better if you stimulate it a little bit. And
Got ya.
and just from like a brain pain standpoint, like you don't want to like disassociate with a body part. That's not typical of something like a total knee, but like sometimes people, like you've heard of like phantom limb pain and stuff like that. Like sometimes people have such trauma that they become a little bit disassociated to their injury, and that actually makes things worse.
Oh, for sure.
So there's a pretty cool technique that I learned in PTA school where, like, if someone has an amputation, they'll do mirror therapy so that their brain thinks that the PT is working on the limb, and that helps like their brain make the connection again and stuff. So, yeah, it's pain science is like fascinating. I'm sure you're like, I'm feeling the pain. Do you have any arnica or to put on the bruising or anything? Has anyone
What's that?
It's just an anti-bruising cream. It's just something that can help with that. If you're concerned about the aesthetics of the bruising, like
I'm not. No,
We-
Dr. Harris and his lead physician Patrick both said that it was going to bruise a lot.
yeah,
I'm actually surprised there wasn't more bruising up here because
yeah.
I guess, well, you can kind of see it too.
Yeah.
There was like a massive tourniquet there.
Have you watched on YouTube?
Oh, I did.
Oh,
She was like, "What are you doing?" I mean, they got bone saws out.
oh, it's gnarly.
Hammers
Oh
and
yeah,
drills.
they're
Just banging away at it, and they put it in there, and they're like wrenching the crap out of it. And
Well, that's why we always ask people about bodily soreness after their surgery,
Oh,
because
yeah.
even like breast implant surgeries and stuff like that, like they are just, they're jostling you
or
so
what
much
about
that.
maybe even like liposuction.
Oh yeah, yeah.
Like they're just going at it.
Yeah, so they're just, they're jostling your body so much, and
Yeah.
they have to be forceful. So it's like, even from a muscular standpoint, you're like,
Yeah.
whoa, you're like, why am I so sore? Or why does it feel like I was positioned like a cactus for 6 hours? Because you were. So when someone comes in for a surgery like this, I mean, I easily could do 45 minutes to an hour just on this leg, especially at this phase.
Yeah.
Usually as post-op sessions progress, it turns into like, okay, I spend about half the session on this leg, and then sometimes like this side, you're like, I'm getting sore over here because this
Yeah.
is my stronger side. So we might do, kind of like more traditional massage strokes over on that side, but yeah, you do have a nice chunk of bruising right here.
Just a little bit.
Just a little bit.
Yeah, it came out and it was just like a little one right there, and it's slowly, and then all the yellowing too.
Yep.
All the yellowing within the last day or two.
Okay, so we're just about wrapped up with our session here. I've done some work just getting the fluid moving in this upper thigh, all around the knee, and then even down to the calf. Eric doesn't really have swelling in the top of the foot, so that's nice, but we have worked this whole thing, and just want to get your feedback, Eric. How are you feeling after this?
Good.
And throughout, everything felt comfortable, painless?
Very comfortable. I mean, it's a very relaxing atmosphere. I mean, it's, the pain that I'm having and stuff like that. I mean, you were pretty close to my incision and everything, and I didn't feel like I wasn't wincing or,
Okay.
like, ow, like quit touching me or something like that.
Yes, definitely. That might start to change as the weeks go on and we get deeper into the muscles. But
Yeah.
but no, as I said, like the whole point of these initial sessions is just to alleviate some of that discomfort of all that additional swelling, help to make your physical therapist's job easier by getting some of the fluid off that joint, and then just hopefully making you a little bit more comfortable. So as you walk around a little bit later today, you just alleviate some of that discomfort and get things moving a little bit more. So thanks for jumping on the table today.
Yeah, for sure. Thanks for having me.